What if the most commonly recommended exercise for poor leg circulation after 60 isn't helping the way you've been told and in some cases may actually be slowing real recovery? This is a difficult truth many people don't hear until it's too late. As someone who has worked closely with surgical rehabilitation, vascular recovery, and age-related mobility decline, I've seen the same pattern repeat over and over again. Older adults do everything they're told. They walk every day. They elevate their legs. They wear compression socks faithfully. They follow advice with discipline and consistency, and yet their symptoms quietly worsen. Cold feet become constant. Ankles swell by afternoon. Burning pain creeps in at night. Balance feels uncertain. Walking becomes cautious. And eventually, one small stumble leads to a fall that changes everything. This isn't bad luck. And it isn't aging normally. Poor circulation after 60 is far more than discomfort. It's one of the earliest warning signs that the vascular system, the heart, and the arteries are under growing stress. When circulation declines, wounds heal slower. Skin becomes fragile. Infections take hold more easily. And in severe cases, untreated circulation loss can progress toward ulcers, tissue damage, and even amputation. What makes this especially dangerous is how quietly it happens. Most people think bad circulation just means cold toes. In reality, it means blood is no longer moving efficiently down to the feet and back up toward the heart. After 60, arteries naturally stiffen and narrow. Veins lose elasticity. Valves weaken. Blood begins pooling in the lower legs instead of flowing upward as it should. By age 70, nearly 1 in 5 adults shows measurable signs of peripheral artery disease in the legs, and many have no idea it's happening. Surgeons don't guess about this. We see exactly what happens when circulation isn't restored early. We see swelling turn into skin breakdown. We see balance deteriorate. We see one fall trigger a rapid decline in independence. The encouraging news is this: restoring circulation does not depend on step counts alone. True recovery depends on specific movements that mechanically push blood back toward the heart. Once you understand which muscles drive that system, the solution becomes surprisingly simple and dramatically more effective than walking alone. This knowledge can mean the difference between walking confidently at 80 or needing a cane by 70. Let's start with the movement most people underestimate: seated ankle pumps, activating the second heart. This movement looks almost too simple to matter, but inside surgical rehab units around the world, it's one of the first exercises prescribed after leg surgery to prevent circulation collapse. Your calves contain what medical professionals often call the venous muscle pump, sometimes referred to as the body's second heart. Every time your calf muscles contract, they squeeze the deep veins in your lower legs and push blood upward toward the heart. After 60, this pump weakens rapidly, especially if you spend long periods sitting. When it underperforms, blood pools in the ankles and feet. Swelling increases. Oxygen delivery drops. Healing slows. Pain rises. Clinical studies in vascular rehabilitation consistently show that simple ankle pumping significantly improves venous return and reduces lower leg swelling in older adults, even without standing or walking. The power here isn't intensity. It's deliberate, controlled repetition. To perform ankle pumps correctly, sit in a chair with both feet flat on the floor. Slowly lift your toes toward your shins while keeping your heels down. Then press your toes into the floor and raise your heels as if stepping on a gas pedal. That's one full repetition. Move slowly. Stay controlled. Aim for 20 to 30 repetitions 2 to 3 times per day. You can do this while watching television, reading, or sitting at the table. Walking relies on momentum. Ankle pumps create intentional muscle contractions that move stagnant blood out of the lower legs, something walking alone often fails to do strongly enough after 60. The result is warmer feet, reduced swelling, less pressure on fragile veins, and a safer way to begin improving circulation if pain, balance issues, or fatigue limit mobility. But ankle pumps only wake the system up. To truly restore circulation, you must strengthen the muscles that prevent blood from falling back down in the first place. Seated leg extensions, restoring thigh-level blood flow. Sitting does not mean easy, and this movement proves it. A 2024 study published in the Archives of Physical Medicine and Rehabilitation found that adults over 60 who performed seated leg extensions with light resistance improved walking speed by 28% and stair climbing ability by 45% in just 8 weeks. Those numbers matter more than most people realize. Walking speed is considered the 6th vital sign in medicine. Slower walking speed strongly predicts higher fall risk, loss of independence, and even shorter lifespan. Seated leg extensions work because they activate the quadriceps, hip flexors, and core simultaneously. These are the exact muscles required to stand up, climb stairs, and rise from a chair, movements that often decline long before people notice circulation problems. When these muscles contract, they also compress large veins in the thighs, assisting blood return toward the heart. To perform this movement properly, sit tall in a sturdy chair with your back firmly against the seat. Place both feet flat on the floor. Slowly extend one leg straight out, keeping the knee as straight as comfortable. Hold for 2 seconds, then lower slowly without dropping the foot. Do 10 to 15 repetitions per leg. Posture is critical. Keeping your back against the chair prevents momentum and forces the correct muscles to do the work. That's where circulation improvement occurs. As strength improves, add light resistance. Even 1 or 2 pound ankle weights make a measurable difference. Muscles respond to progressive resistance at any age. This movement reduces stiffness, improves walking tolerance, and strengthens the muscles that move blood through the upper legs, something ankle pumps alone cannot accomplish. But even strong legs won't protect you if your balance system is weak. Standing heel raises, strength, circulation, and balance combined. This is one of the most overlooked movements in senior fitness, and one of the most powerful. Research cited by the National Institute on Aging shows that calf strength is one of the strongest predictors of independence after 60 seniors. With stronger calves experience fewer falls and are far less likely to require assisted living. Here's why. Calf muscles act as mechanical pumps. When they contract, they squeeze deep veins and force blood upward against gravity. Weak calves allow blood to pool. Swelling increases. Oxygen delivery drops. Balance reactions slow. Standing heel raises don't just build muscle. They retrain circulation and balance at the same time. Stand behind a chair or countertop and hold lightly. Rise onto the balls of your feet, lifting your heels as high as comfortable. Pause for 2 to 3 seconds at the top while looking straight ahead. Then lower slowly over 3 seconds. That pause is critical. It forces your balance system and calf muscles to fire together. Exactly what happens when you catch yourself during a stumble. Start with 10 repetitions. Gradually work up to 20 or more. This single movement improves ankle stability, venous return, reaction speed, and confidence without stressing the joints. Now we enter the top 2 movements. This is where circulation recovery accelerates. Single leg circulation hold, where balance meets blood flow. Standing on one leg isn't just about balance. It's about sustained muscle pumping. Large population studies referenced by National Aging Institutes show that the ability to stand on one leg strongly predicts future falls, mobility loss, and physical decline after 60. But here's the circulation connection most people miss. When you stand on one leg, the calf, ankle, hip, and core muscles must contract continuously to keep you upright. That sustained contraction creates a prolonged muscle pump effect, especially in the calves, far stronger than walking, where you're only on one leg briefly. To perform this safely, stand next to a chair or counter. Lightly place one hand on it. Shift your weight onto one leg and lift the other foot slightly off the floor. Stand tall, eyes forward. Breathe normally. Hold for 20 to 30 seconds, then switch sides. Do 2 rounds per leg. As balance improves, reduce reliance on your hand. This exercise improves circulation, strengthens stabilizers, retrains the nervous system, and dramatically lowers fall risk, all while keeping blood moving upward instead of pooling. But there is one movement that surpasses them all. Standing calf pump hold, the gold standard for circulation after 60. This is the movement surgeons rely on most. Across vascular rehab programs worldwide, one exercise appears again and again because no other movement activates the calf pump as powerfully, safely, or consistently after 60. Your calves are pressure pumps. When you rise onto your toes and hold, those muscles squeeze deep veins and physically force blood upward against gravity. The hold is what changes everything. Stand behind a chair, feet hip-width apart. Rise onto the balls of your feet and hold the top position for 3 to 5 seconds. Breathe normally. Look straight ahead. Then lower slowly over 3 seconds. Start with 8 to 10 repetitions. Work toward 15 to 20 with control. This sustained contraction improves venous return, reduces swelling, strengthens ankles, and retrains the muscles that prevent falls with minimal joint stress. Final thoughts. Why these movements matter more than walking alone. Walking is valuable. You should continue walking, but walking alone leaves critical gaps. It does not fully activate the muscle pumps that move blood out of your legs. It does not train sustained balance reactions, and it often fails to prevent circulation decline after 60. These 5 movements fill those gaps. They take less than 15 minutes per day. They require no gym, and they restore circulation, strength, and confidence where it matters most.